Hello and welcome to Unleashed, the show that explores how to thrive as an independent professional. I'm your host, Will Bachman, and I'm here today with Paddy Padmanabhan, who is the founder of Damo Consulting. Paddy focuses on healthcare digital transformations. He's out with his second book. Paddy, welcome to the show.
Thank you for having me, Will.
So, Paddy, tell me a bit about your second book. You said before we started recording here, you were about to publish this book at the end of first quarter, and then the pandemic hit. You held off for a couple months and you added some chapters in there. Tell me about your new book on healthcare digital transformation.
Glad to. So, the idea for the book came about when I was working with my co author, Ed Marks, when he was CIO of Cleveland Clinic. And we did a lot of work together. We helped develop an enterprise digital transformation strategy for the clinic. And we had done other work as well, in his role as CIO in other organizations, and in my role as CEO of my firm, Damo Consulting, which advises health systems on digital transformation strategies. So we thought of bringing all of our learnings and best practices together in the form of a handbook or a guidebook, if you will, for practitioners of digital transformation in healthcare. We started writing the book in 2019, the later part of 2019. And in the first quarter of 2020, we actually had handed over the manuscript to our publisher for their proofing and editing. And then the pandemic hit us in around about March, and we knew that everything had changed. What we decided to do was to hold off on publishing the book, and we talked to our publisher, and we said we want to hold off for a quarter or two because we really want to see what the pandemic does to healthcare and to digital health and digital transformation in healthcare. Is it going to kill it? Is it going to accelerate it? What is it going to do? We want to know, and we don't want to necessarily put a book out there that talks to primarily the pre-pandemic era. So, to our surprise, to our pleasant surprise, many of the themes in our book held up after a quarter into the pandemic. And we, of course, learned a lot of new things about how the pandemic was changing the way health systems were reorganizing themselves for the future. So we took all of that and we added not just a couple of chapters. We actually added, I think, one section in the first chapter, but then we rewrote some of the other chapters to align with what we were seeing in the market. So we kind of refreshed it, if you will, the entire book. And then, of course, we handed it back to the publisher, and the book's just come out a couple of weeks ago. So
Congratulations.
that's yeah. Thank
So,
you.
so someone who is not deep into this might ask, "Hey, I thought there was something in Obamacare about all about funding electronic health records. I thought we were sort of done with that." Walk us through what are the things in healthcare that are not digitized that still require that digital transformation. So real specific examples would be helpful. What are some of the things that could be digitized but are not yet?
Yeah. So I like to start, Will, by uh, make a distinction between digitization and digital transformation, or what some refer to as digitalization. And the difference is important. So you're right. When Obamacare came about, which was over 10 years ago now, the Affordable Care Act, the High Tech Act, and so on, what we really did was we took paper and converted it into electronic documents. So we went from atoms to bits and bytes. And that process took nearly 10 years to complete because healthcare was operating on paper. And both you and I know from our doctor visits back in the previous decade how that used to feel. And it took 10 years to complete that process, and that process was completed using a number of tools. The government provided what was known as meaningful use incentives, which was basically a sort of taxpayer-funded subsidy to hospitals and clinics to go out and buy a certified electronic health record system, implement it, and demonstrate that you're meaningfully using it. So that was what meaningful use was all about. And fast forward to today, we're about, I would say, for all intents and purposes, we have 100% penetration of electronic health records. So it would be a rare clinic or a hospital which is not using an electronic health record system today. I would say that for all intents and purposes, everyone is using it. Now, what's happened as a consequence of that is that we've just taken paper and converted it into digital documents. Nothing has changed. Now, now comes the opportunity for us to take all of the data that is now available in electronic format, be able to analyze it, be able to do smart things with it by running algorithms and so on to drive care decisions. So it could be diagnosis decisions, it could be treatment decisions, it could be population health management decisions, wellness, care, and so on. But it also now has opened up opportunities to completely change the way care is delivered because the technologies are now available for folks like you and me. Well, just like we are on the phone today, we can actually get on the phone with our doctor through a video consult platform and have a visit. So let's say you have a pain in your ear and you want to find out what that is about, but you don't necessarily want to go into the clinic. You can do a virtual consult. That's a simple example of how the doctor is now able to have a patient visit through a virtual real-time digital platform, which in this case is what you might call a telehealth platform. But the doctor is using all the data about you, which is sitting inside the electronic health record system. So we are now taking the entire experience to a whole new level. That is what digital transformation is about. And I gave you just one example, but that is kind of a representative example, if you will, of what digital transformation means today.
Okay. So one example would be instead of having to physically go into the office, I can get on a Zoom video call or a video conference with my doctor, and they can't obviously sit there and look in my ear or whatever, but I can explain my symptoms. Maybe they have some remote diagnostic thing. They can take my blood pressure or whatever, and so that. What are some other things that are that could be transformed, so through a digital transformation? What are some other aspects of healthcare where we're like not where we could be today?
Yeah. So let's take one example. Practically every aspect of healthcare delivery can be transformed in some way or enabled in some way by digital tools and technologies. So let me take one example, and this is let's take the example of what is broadly referred to as access to healthcare. So you are a patient or a healthcare consumer, as you're referred to today, and you want to get access to care from a physician for a condition that you don't quite understand yet because you're displaying some symptoms. There are many ways in which digital tools can be made available to a patient such as yourself as you go through the journey. Now you're talking about patient journeys. As you go through the journey of understanding that A, you have possibly a medical problem, B, you want to quickly find out what it could be, C, find a doctor with whom you can have a quick consult to find out whether it is serious or whether it is fairly benign, and finally decide if you need to go into a clinic or not, right? So you can enable a lot of this. And then, of course, you have to pay for all this, which is the final step in the process before you actually get treated. A lot of this can be enabled digitally. You could have an online symptom triaging tool that where you can through a conversational interface, key in some symptoms, and it'll tell you, so, well, you've got an ear infection, right? So here are the three possible things that it could be pointing to. So why don't you set up a video consult with Dr. Smith? And the tool will directly take you to a scheduling tool where you can go in, look up Dr. Smith, look up when he or she is available to meet with you, schedule a consultation, and then Dr. Smith calls you at that time through Zoom or any other platform which is compliant with data privacy standards and that pertain to healthcare. And then you have your consult, and then Dr. Smith tells you, you find, well, there's nothing. I'm going to send a prescription electronically, of course, a prescription over to Walgreens, which is tell me your zip code, and I'll find the Walgreens that is closest to you. Go and pick up the prescription, and take this medication for 3 days. And if it doesn't change, call me back. This is a simple example of a journey that people go through. Now, I've described the journey in very simple terms, but there's a lot of technology that needs to be put in place. The technology needs to work seamlessly. They're not all from the same technology provider, so they have to talk to one another. So there's data interoperability involved, and then they all need to talk to a backend medical record system, which tells the doctor who you are, what your medical history looks like, and eventually connect it up with your financial details to take your payment for your copay and so on. So without complicating it too much, this is one example of how digital transformation helps hospitals and health systems and patients take advantage of technologies now to virtualize the experience. That is one way of looking at it.
Why is it so often that today doctors' offices don't even interact with you via email? Is it all like HIPAA related, and how do we overcome that? I mean, like every other business in the world will email you, but it seems like doctors' offices, they want you to call, or like it's almost impossible to get them to send you an email.
Yeah, well, HIPAA is definitely a primary reason why they will not email you. But there are now uh, communication tools that are HIPAA compliant through which doctors will communicate with you. It could be an SMS tool, which is HIPAA compliant, which when they send the messages over, they encrypt it and it's secure and so on. And that could be one way they'll communicate with you. But today, increasingly, doctors are communicating with their patients through an electronic health record interface. So depending on who your doctor is, you could actually go onto their portal where you could go in and send a message to your doctor, which is what I do. And I actually, meet my doctor just once a year for my annual physicals. But the rest of the time, if I need anything, I send a message over. It's asynchronous, but it works. But for it to work, both the patient and the doctor have to be willing to make it work using the technology tool that is available. So you don't have to really phone in if your doctor is well on the way to digitalizing the interface with the patient. But for certain things, you're going to have to call in. But those may more and more become exceptions than the rule. So yes, it is changing. But again, depending on where you are, the degree of change may feel like more or less. And so, other than that, I would say that we're already on our way.
All right. What sort of changes are you seeing in healthcare, with the respect to digital, due to the pandemic? What have you seen?
The first and foremost thing that I have seen is that there is definitely an acceleration towards virtual care models and telehealth models. And I've written extensively about this as well in my columns in CIO and other publications. What is really happening today is when COVID hit, so think about what happened when COVID hit us. You could not go into a clinic, right? They didn't want you unless you were actually down with coronavirus. So if you had a an elective surgery, for instance, you needed to do hip replacement, let's say, you just couldn't do it. They didn't want you coming into the hospital because the hospital capacity was totally taken up by coronavirus cases. But leave aside hip replacements. If you just wanted to have a normal consult like this ear infection that I talked about, even if you wanted to go in and meet the doctor, you couldn't do it. At the same time, doctors also had to take care of their patients. So everybody quickly got onto a telehealth means of operation. So everybody learned how to use video consult platforms, both doctors and patients, not just doctors, but also other caregivers. And they figured out how to start working with it and using it. And the numbers are out there. We saw, 10 to 15x increase in video consult visits in the immediate weeks after the pandemic hit us. Now, that's more than the entire previous year's volumes when it comes to telehealth visits. So that's not something that is trivial. It's not an incremental change. It is a step change. It's a quantum change, if you will. And those changes, when they happen, they set off some irreversible processes. One of them is that now telehealth is here to stay. Telehealth and virtual care, so the virtualization of care delivery is here to stay. Now, we may have swung very, very hard to one side in the immediate wake of the pandemic because there were no options. You had to do everything remotely. You had to do everything virtually unless you actually had the virus. But now, of course, we're going to see a little bit of a shift back, a reversal to the mean or a shift back to the equilibrium, if you will. But even then, the needle has definitely swung in favor of telehealth. And of course, in healthcare, as many of your listeners might know, well, everything is about the money, follow the money. Most healthcare payments are reimbursed in some way, shape, or form by private or government insurance. So, in your case, it could be your employer, it could be Medicare, it could be Medicaid. So ultimately, who pays for it and whether they pay for it determines whether you're going to deliver care in a certain way. One of the big things that the CMS did in the immediate wake of the pandemic was to make telehealth visits eligible for reimbursement pretty much at the same rates as in-person visits. And so there was obviously more willingness to stay with the telehealth model. And now, of course, we are hoping, the industry is hoping that these concessions will become permanent. And if they do, then we've crossed a point of no return. So this is one big change that has already happened. And there are related changes that are happening, when it comes to, I'll give you one, the desire for contactless experiences now. Even if you go to a hospital, people don't want you touching anything. You don't want to touch anything. So try to do everything contactless. Your payments, now you go to a grocery, you're going to, more likely than not, swiping your phone and paying, right? Is more likely than not sticking a credit card into the reader. The same thing is happening in hospitals. So facial recognition, contactless check-ins, things like that. Those are things that are happening as we speak. So we are going to see some of the experiences change. So those are two things that come to our mind right away in the immediate wake of the pandemic.
So some of that telehealth change before the pandemic, there must have been some demand, at least from patients, on that. Like, hey, if it's, if let's say you have a little spot in your skin, right? It's either, and you're concerned, it's kind of new. Is that cancer or is that just something totally benign, right? Maybe you want to see a dermatologist. Well, you'd probably prefer just to snap a picture or whatever, or have a Zoom or video conference and say, hey, look at my skin. But previously it wasn't very easy to do that. What was holding that back? Was it really? And probably the providers would probably be happy that just fewer people in the office, they can crank people through faster. Was it really the reimbursement was the blockage for that?
Big part of it in healthcare, you have to follow the money. I kind of go back to it. A big part of it. So in healthcare, most of healthcare is in what is known as a fee-for-service model.
Right.
What that means is, you get paid by volume. So you do a visit, you get paid, X dollars for the visit. If you do a lab test, you get Y dollars for the lab test. Everything is very unit based, right? A unit of activity will get you a unit of reimbursement, and there are big this whole big kind of directories of tables of rates and so on and so forth. But with the industry moving towards what is known as accountable care and value-based care, increasingly providers are taking responsibility for the patient populations that they manage. And when they take responsibility, they get upsides for improving health outcomes for their populations. And there's a whole set of formulae that the government has worked out, especially in the context of Medicare. And if you meet those numbers and you beat those numbers, you can actually make more money than you would make money in a fee-for-service model. Now that is work in progress, and these models will take time to take hold and become more commonplace. But the vast majority of the system today is on fee-for-service, and when it's fee-for-service, the teledermatology example that you talked about, while it's available, it's cool, and it's convenient, there's got to be a fiscal financial motive for the party on the other side, namely your doctor, or even more importantly, the doctor's employer, which could be a big hospital, to actually encourage it. Now, from a demographic standpoint, a lot of people, especially younger urban dwellers who do not want to necessarily go into a clinic, who want care at a time and place of their choosing, they would love this. Okay, I'm gonna, I got a rash on my skin. I'm gonna send you a picture, and these apps already exist. I'm gonna send you a picture. Tell me what I need to do. Do I need to just go out to Walgreens and buy this ointment, or what do I need to do? Do I need to come in? And they're happy with that. But there's a big section of the population that may still want to come in, and then there's of course this whole motivation or lack of it based on the reimbursement models that people are functioning with.
But on the reimbursement side, it sounds like previously the reimbursement for a telehealth visit for the same purpose, right? Let's say you're going to see a doctor and they're going to evaluate you for the same purpose. Previously, it sounds like the telehealth reimbursement was lower than it would be if you went into the person in office. What was the force keeping that in place, keeping that status quo in place? Who benefited by making people go into the office? Was like Medicaid or CMS afraid that people would abuse that and just like run up big bills, or like why did they care? Why didn't they just say, well, if you need to get your spot looked at, we don't care if it's in person or via telehealth?
I think it's a matter of being able to do this in a very deliberate way, so that, to your point, you minimize the opportunities for abuse, and then doing it in a very kind of a controlled way. And I think that was probably what was driving it, which is why the progress was slow, and the reimbursement models were really holding back the growth of telehealth pre-pandemic. If you looked across the nation, and there were no clear reimbursement guidelines in place. People didn't know what they were going to get reimbursed if they did a telehealth visit for this or that procedure or this or that condition. And you have to remember that in healthcare's pricing is very, very complex. There's like thousands and thousands of codes that determine what you get paid for a certain kind of activity, those units that I talked about. So it's a question of change, the appetite for change, and the ability to execute change. But all of that was simply forced upon us by COVID-19. And so in one fell swoop, as they say, the CMS lifted all the restrictions as it relates to Medicare, and pretty much all restrictions. They said, we're going to reimburse you pretty much at the same level. There's some nuances to it. It is still not 100% of what it, but setting aside those nuances, for practical purposes, yes, they kind of brought it on par, which was a huge leap for the industry as a whole.
And what have private insurers done? Have they followed suit?
Private insurers have always, I think, preferred this because it keeps their costs low. And if you're going to pay for Medicaid, if you're going to pay for telehealth visits at 30 cents to the dollar, hey, you want to encourage more telehealth visits, right? As an insurer. So I think they were always ahead of it in terms of encouraging it. But who would want to cannibalize their own revenues, right? So if you're going to get $1 for an in-person visit and you want to swap it out for a 30-cent visit, who would want to do that?
Mm-hmm. Okay. Um, Give me some examples of work that your firm has done. So, to give us some real examples of what a healthcare digital transformation project looks like.
Yeah, yeah, great question. That's what this whole book is about, Will. And so when you look at digital transformation, you're looking at completely transforming your business model, right? How in the context of healthcare and hospitals and health systems in general, how you how you provide access to care, how you deliver care. These are the two big aspects of a healthcare operation. And access is what we just talked about, telehealth, virtual consults, and how a patient gets access to care. And then how the care is delivered, and whether you're a patient at home, whether you're a patient in the hospital, in the ICU, how it gets delivered, and what are kind of the tools and technologies that you can use to improve the quality of care, improve the convenience, and improve the outcomes, the ultimate healthcare outcomes for the patient, and do it all in a cost effective and productive way. Right? That's really where your digital transformation strategies come into play. So if you take the example of a large hospital system that wants to really transform the way it provides access to care, they would look at everything, and this is what our firm does, and look at everything from how you design your portal, how you design the experiences on your portal, how you make available online tools that can help patients self-serve themselves, whether it is symptom triaging, whether it is a chatbot that through a conversational AI interface can tell you what your condition is, connected to a scheduling system that helps you find the doctor of your choice and schedule an appointment. And then, when you come into the office, let's say you have a serious condition, you're going to be in the ICU, what kind of technologies can allow hospital, clinicians, critical care clinicians in the hospital to really look at all of their critical care patients using tele-ICU kind of technologies. But all of this is also supported by core IT infrastructure, your LAN, WAN, your bandwidth, your devices and how they work, and where your electronic health record system resides, and how the data gets pulled from it. How do you do your data and analytics in order to understand which parts of your population are at risk and who specifically individually is at risk? All of this needs to be redesigned. Right? That's what the leading health systems of the country today are investing in. But I also have to say that while this is kind of the holistic, comprehensive view of what healthcare digital transformation is, not everybody is at this holy grail, if you will. We have a maturity model that we use to really help health systems understand and assess where they are. It's a four-stage maturity model, going from 1 through 4. One, which is the least mature, is a model in which you basically look at your electronic health record system and you say, everything that I do is going to be done through this system and whatever capabilities this system provides to me. Well, that can be pretty limiting because the EHR system doesn't give you everything that you need for your future state. So what do? You layer on a handful of best-in-class tools to provide patients with digital experiences, and you kind of wrap your electronic health record system around it. So that's model 2, and then so on. And in model 4, which is our most mature model, is what I talked about earlier, which is a comprehensive transformation of your core IT infrastructure, a transformation of the way you deliver care, the processes, the change management, and ultimately, creating digital front doors for patients to gain access to care and to receive care. So that's kind of what this landscape looks like now. And health systems across the country are at different stages of maturity. We have 5,500 hospitals in the country. If I were to look at Model 4, which I talked about, maybe there's only 50 of them that are somewhere in that journey towards the Model 4. The vast majority are in Models 1 and 2. And so what we really do is help people understand where they are, help them assess their maturity levels, and help them move up the maturity model because everyone wants to get there.
What changes should we expect to see as patients in the next 1 or 2 or 5 years? How will it look different receiving healthcare?
You should, as a patient, and I am one too, just like all of us are, and What I would want to see, and what I think we are going to see, is number one, more transparency, which means you're going to see, you know, you're going to be able to access more information about the costs of care, your options when it comes to getting a certain kind of care, more information about who is delivering the care to you and how qualified they are, and how much expertise they have in that subject. Uh, you know, what is the reputation of the hospital that employs them, uh, and a bunch of other things. So we're going to see a lot of transparency and consequently choice. So that's one thing we're going to see. We're going to see a dramatic increase in convenience, which means a lot of the things for which I go through very clunky experiences to gain access to care. To your point, Will, earlier about having to make a call because your provider won't call you back, all that will go away. You will be able to get access through a device of your choice, whether it's a desktop, whether it's a smartphone. You will be able to get access to most care, most of your answers to most of your questions, uh, and it's going to be done in a very convenient and seamless way. These are two things uh, that are definitely going to uh, change dramatically in the coming few years. There'll be other things too that may not be as visible, but you're also going to see from a structural standpoint, you're going to see a lot of new players offering healthcare services that you may not have considered as healthcare companies today in today's context, and they are emerging, and in another 3, 4, 5 years, the landscape is going to look very different. So,
Are you talking
uh,
like Amazon or Google, or what are you referring to?
yeah, we're talking about. Let's start with, we're talking about companies like CVS, or Walgreens. They're kind of in the peripheries when you think of primary care, when you think of going to a hospital for something, but they may become more and more mainstream when it comes to your healthcare needs.
Well,
So that's one.
they got the Minute Clinic, right, at
Yep.
CVS.
The
Yeah,
CVS has the Minute Clinic,
yeah.
and Walgreens has now, been making. They've started offering a lot of healthcare services through partnerships through their app. But that's just two examples. You're going to see um, one or two of the big tech companies getting into healthcare in a big way. Apple already is, but not as a healthcare provider. Through their Apple Health app, you can actually connect your Apple phone data, your personal data through the Apple Health app, and combine it with your medical records from your provider. And it's just simple. You just click a button on your app, and if your provider is signed up to be part of the Apple program, then the data gets combined, and then eventually you could conceivably start accessing some of your care needs through an Apple Health app. That's not the case today, and I'm not saying that I know more than what the next person knows, but I'm just saying that that is potentially a logical step forward for a company like that. You're going to see other emerging players. Last week we saw the announcement of the merger of two big digital health companies, Teladoc and Livongo, and they are going to create entirely new care healthcare organizations with entirely new digitally native care delivery experiences. And that's going to dramatically change the landscape as well. So you're going to see a lot of change. But as a patient, as a consumer, what you care about most is convenience, cost, transparency. And you're going to see all of those change in your favor.
Can we talk for a minute about your work creating thought leadership? So you come up with this book. You also mentioned that you have a column. Could you talk about that and any other sort of thought leadership or writing or speaking that you do?
Yeah. So I write extensively in healthcare industry publications. Uh, so I have a long running byline column in CIO magazine where I talk about healthcare technology trends, digital health tech trends in particular. I've written nearly 100 pieces there over the last several years. I'm frequently published in other publications as well. In addition to that, my company constantly puts out research. We track digital health trends across the market. We track what the big technology firms are doing. We track what digital health startups are doing. We track what the big health systems are doing. We're constantly putting out research, and we do more research through our partnerships with industry organizations like Chime, where we really go in and do in-depth surveys and research and focus groups. We're constantly on top of what is going on, what the changes are, and we publish research on it. Most of it can be pulled off our website. And in addition to that, of course, through our work with our clients, we learn a lot about what is actually happening on the ground, how decisions are made, what gets prioritized and what doesn't, what are the drivers based on individual institutions or their marketplaces. So all of that really drives the thought leadership that I put out and my firm puts out. So those are just a few examples.
And what sort of impact has that had? Do you get a lot of your work through inbound inquiries from people that have seen your work in various places, like CIO Magazine, or just what's been the impact of all that effort?
Great question. It just so happens that this past quarter, we signed our first ever contract, a consulting engagement to develop a digital transformation roadmap for a big health system. We never met the client. I never knew the client. We didn't meet them during, obviously we didn't meet them during the engagement because of COVID-19 restrictions and so on. They came to know about me through my writings and my thought leadership and the work that my firm does. So yes, it certainly has helped our brand as a company, and of course my personal brand as well, which is what our business is all about. And a lot of the work therefore just comes in through word of mouth. Uh, so it's a few different things. One, the work that we do for one healthcare client, the word gets around about the work that we do. And healthcare is an industry where there's a lot of it's a fraternity, and word gets around. So that's definitely one part of it. And secondly, of course, all the work and the thought leadership that we do. I have my own podcast where I feature guests who are C-level executives from healthcare, mostly technology executives. So they come in and talk about what they're doing, and uh, we get to learn from that, but we also get to share best practices that others, their peers, get to learn from.
Mm-hmm.
So, and then I publish a weekly newsletter where we analyze the events of the past week, where we publish our own research. We publish charts, and we share our podcasts, and we have guest blogs from some of our clients and our industry colleagues. So that's another way through which we really care deeply about sharing our knowledge and being seen as thought leaders through that sharing and the vibrant exchange of ideas with our peers and colleagues in the healthcare tech community. And
Wow.
that's really how we do it. Yeah.
How do you do your newsletter? Are you reading all that news yourself? Do you have a member of your team who's helping to do that research and pull that together?
There's a team that curates the news items, and the newsletter contains articles that are curated from what has been published, but it also includes some of our own publications, including my own publications. So most weeks it's the curation of articles on a particular theme or a topic, with maybe a piece that I published during that week, or maybe a new piece of research that we published. So there's a team that does that, and we get together every week. We look at all the pieces, and then we decide which ones go in. It's usually about half a dozen pieces that we include in a weekly newsletter, and then I put in some commentary on that as well.
What sort of investment have you made in building an audience on Twitter or LinkedIn or other social media? Or are those relevant to your space?
Twitter and LinkedIn. It's very interesting you asked the question because the experience on Twitter and LinkedIn has been very, very different for me. My own profile and following in LinkedIn is far more than it is on Twitter, and I use both for work. So I don't mix my personal life with my work life in Twitter, and of course I don't do that in LinkedIn. No one does that. But my engagement and followership on LinkedIn is far higher than it is on Twitter. For my company, it's the exact opposite. My company's Twitter following and Twitter engagement is far higher than the company's engagement on LinkedIn. So we kind of, obviously we go with what works, and we kind of invest in that. And then, of course, we do a lot of, my team. I have a fantastic brand marketing team. They do all the fun stuff in the background with the SEO and the Google Analytics and Google Search and so on. So they pull out some magic, and I just uh, I just follow along with whatever they tell me to do.
Got it. Well, speaking of all that, where can people go online to find out more about your work?
So uh, you can Google me, of course, Paddy Padmanabhan, and you'll most likely, if my marketing team is right, you'll probably find me on the first page. But you can find my company, democonsulting.net, and go to my personal website also, is thebigunlock.com. The Big Unlock is one word, .com. And that's got my profile, all the work, my publications, my speaking engagements, my podcast, my newsletters, thought leadership. I'm a guest on various podcasts, and I speak in industry conferences. And of course, I interview and host a lot of guests on my podcast as well. So all of that you can find it on my personal website, or in my company website.
Amazing. Well, you are one of the most productive people I know, uh, cranking out books, a podcast, a newsletter, while still managing to actually run a firm and do some consulting on the side. Uh,
Well, yeah, and I will tell you, I'm not going to just take the credit for all of it, because the truth of the matter is that I have a rock star team that supports me. They're kind of, behind the scenes. They let me stay in the limelight, if you will. But I am very fortunate to have a really, really strong team that works with me and supports me. And I've been in this a long time, so it's taken a long time. So it's, as you can understand. Uh, but we are very committed to this, and we really care about the space that we are in, and we care about the community that we're a part of. I think that makes a difference.
Fantastic. Well, Patty, we will include those links in the show notes. So to find out more about Patty, check those out. We'll also include the link to my Twitter account. I'm getting more active on Twitter, so I post there now pretty regularly. If you want to follow me, it's at Will Bachman on Twitter. Thanks for listening.
All right, thank you. Well, it's been a pleasure being on the show. Take care.